Hello everyone, I am urologist Omer Makaya. Today we will talk about the relationship between varicocele and testosterone. Varicocele is observed around 15% among men. We see that this rate increases up to 50 to 60% in those who do sports, those who are engaged in weight sports. So what does varicocele do? What is varicocele like? Varicocele is a condition characterized by excessive dilation of the veins leading from the testicles, the veins that are supposed to bring the blood of the testicles back to the body, and the accumulation of blood in these veins, which cannot move actively within these veins. As you can see here in the photo. What happens when varicocele develops? You can liken varicocele to varicose veins in the legs or hemorrhoids in the anus. Because these are all vein diseases. What does varicocele do, friends? Varicocele causes an increase in heat in the testicles. It prevents blood supply to the testicles. It causes hormonal disorders. It reduces blood flow in the testicles. It disrupts the flow of metabolites in the adrenal glands. Most importantly, it can cause problems in the functions of testosterone-producing cells in the testicles, Leydig cells. A lot of research has been done. Does testosterone increase after varicocele operation? In men with hypogonadism, which is loss of sex drive, erectile dysfunction, decreased body energy, and at the same time low testosterone, if we perform varicocele operation instead of testosterone treatment, can we both achieve a permanent testosterone increase and save the patient from drug treatments? Such practices are being done abroad, friends. There are also many studies on this. Because among the varicocele series, testosterone increase was detected in many series. Let's briefly look at the series here. This has been practiced since 1995. For example, from 319 to 419. That's a 30% increase. In another series, from 648 to 709. In another series, from 200 to 454. In another series, from 233 to 325. There are many series. For example, another study conducted in Turkey. It increased from 255 to 372. There are dozens of varicocele series, friends, and 80% of them have a significant and sustained increase in testosterone. Now, an important issue here is that when the blood supply to the testicles increases, when hypoxic conditions are eliminated, the Leydig cells in the testicles begin to function more properly, and this increase in testosterone does not only remain in laboratory results. It also provides a significant improvement in patients' functions such as erection, sexual function, sexual satisfaction, and increase in energy. We already see this in the clinic. Indeed, in patients in whom we perform varicocele operation, there is a recovery in sexual functions in a short time. Especially the lower the testosterone, the higher the testosterone increase in the patient. It should also be noted that it is not enough just to perform a varicocele operation and send the patient away. It is imperative to make recommendations on vitamin-mineral levels, microelements, nutrition, and lifestyle correction. The patient's sleep patterns, physical activity, as I said, these are very, very important, friends. At the simplest level, if folic acid is low, if vitamin D is low, you need to correct this. These are different. Also, how to perform varicocele surgery is also very important. Varicocele should definitely be done with microsurgical methods. And in selected patients, I especially recommend using Doppler ultrasound for the arteries leading to the testicle, which are difficult to see even under a microscope, as better results are obtained. We perform varicocele surgery to improve sperm quality, motility, and viability, but I think varicocele surgery can be performed instead of testosterone replacement therapy in some selected patients. Especially if there is a very obvious varicocele, shrinkage or softening of the testicles, it is beneficial to perform this operation under the circumstances I just said. Of course, it can increase the patient's nutrition, vitamin-mineral levels, hormone levels to some extent. As a result, if you have varicocele and your testosterone is low, I think it would be useful to consult a urologist in terms of varicocele operation. Thank you for listening, best regards.